Hello and welcome. Good morning. Today I want to do things a little bit earlier because yesterday the posts were so late that I felt like it was important that I get out early this Sabbath morning. So we have another great topic today where we're going to talk about heel spurs and Haglunds deformities. As you know, we've been talking about plantar fasciitis, heel pain, Achilles tendonitis yesterday. But this is also a problem, and a lot of times people will come in thinking they have plantar fasciitis or thinking they have a injury to the heel or something like that. And in fact, they actually have spurring. Now, to give a little bit of background, again, here's the heel. There are two different areas you can have a spur. You can have a heel spur in the back. You can have a heel spur on the bottom. When you have a heel spur on the bottom of the heel, the symptoms really usually are plantar fasciitis itself. The heel spur they've found in studies does not cause pain. Therefore, we actually can treat the plantar fasciitis, resolve the problem, leave the spur, and you don't have any issues. The reason being it's parallel to the ground, so you're not actually feeling that spur itself. The spur is more of a symptom of plantar fasciitis as opposed to a problem that needs to be treated. Now, that's not the case for the spur on the back of the heel. On the back of the heel, a heel spur, especially right at the insertion of where the Achilles tendon is, can cause significant irritation to the Achilles tendon and causes significant problems similar to Achilles tendonitis, but is typically more painful. And we call it calcific Achilles tendinosis, meaning that you have calcification inside the Achilles tendon. The problem with that, there's not a lot of options as far as treating it. You could do things to treat the tendonitis and tendinosis and reduce the pain, but it doesn't fix the problem until ultimately you go in and actually treat that spur. So in that case, you got a heel spur back here, you got the Achilles tendon that attaches, you actually have pretty significant discomfort. So you say, okay, what can I do to alleviate that problem? Other than padding to reduce shoe touch to that heel spur area, or heel lifts that will take the pressure off the Achilles tendon, really you need to go to treating it surgically because of the spurring that is actually there. There are several different ways that can be treated, that you can treat this surgically. The most effective way I've found so far in my hands is to go in and actually split that Achilles tendon, you clean out the spurring, and you actually fix it that way. So how does that work? If you basically take right at the insertion, you've got the Achilles tendon there, you'll actually take and you'll cut into that tendon, open it up, and you can get all the bone out of that area. And then you throw little bone anchors in the heel to actually reattach it. The advantage of this surgery is you can usually walk on it right off the bat in a boot, and you usually don't lose any strength because we leave attached the sides of the Achilles tendon. So it stays basically attached, but you remove the area that has to be removed to be able to get the spurring out. And this is a very effective treatment, typically. As with any spurring, 20% of anything you take off comes back, so you do it in such a way so that when 20% comes back, it's not continuing to have a spur that irritates that Achilles tendon or rubs on shoes. This is a pretty big problem that oftentimes we'll see, and this is diagnosed through location of tenderness as well as x-rays, as we discussed yesterday. There's a second type of spurring that does not directly affect the Achilles tendon called a Haglunds deformity, which is a bump or an overgrowth of this portion of the bone. What happens with that portion of the bone is it gets larger and you start to feel rubbing on the shoes and you start to get inflammation around it that is affecting the Achilles tendon. And it's called a Haglunds deformity. The most common location would be on the outside. So you'll actually have a bump. You'll have the Achilles tendon in the back and then you have a bump on the side that is pretty problematic and pretty sore, and it gets worse over time. The biggest complaint in this case is you feel rubbing on your shoes, and certain shoes cause more discomfort. Now, treatment-wise, there's several different ways that it can be treated. One of the ways is they actually look at it and say, okay, I'm going to just do padding. There are different types of sleeves and so forth that you could actually gel pad that area, and they stop rubbing on the shoes, and that fixes the problem. Other times people will do shoes that don't have a back on them. This is relatively easy as there are many types of women's shoes that do not have a back that will actually touch in that area. Both cases, padding or shoes without pressure to that area, you're really just treating the symptoms and you're not fixing the problem. You may have to go in and actually take a portion of that bone out to actually really fix the problem. Now, as opposed to the heel spur that's inside the Achilles tendon, this sits in front of the Achilles tendon, which allows a surgery where you can actually go in and not touch the Achilles tendon itself, but actually remove the bone without injuring the Achilles tendon. The advantage of that is you get back to normal more quickly. There is no healing of the Achilles tendon that is required, and it's really just a matter of getting the incision healed to getting back to normal shoes and normal activities. A lot of times for 2 to 4 weeks, I'm actually protecting that area to try to alleviate any possible irritation of the Achilles tendon as you recover. By giving that period of recovery, most people get back to normal activities relatively quickly. So, what did we talk about today? We talked about plantar heel spurs on the bottom of the foot. They are not symptomatic usually have the plantar fasciitis instead. You have a posterior or the back of the heel spurs, which can be problematic, usually irritate the Achilles tendon and often require surgery to fix. And we talked about the Haglunds Deformity, which is also on the back of the heel, but usually on the outside or the lateral side of the foot. And you'll actually see a bony prominence that can be problematic and similar, usually require surgery to fix the problem. So if you still have heel pain, if you have heel pain on the back of the heel, the best thing to do is get an x-ray to determine if it's just an Achilles tendonitis or if you have a bone spur or heel spur in that area or Haglunds deformity in that area that would require surgical correction, and then to find a way to get it treated. In the meantime, heel lifts may help. Shoes that don't rub in that area may help. And just as any inflammation, ice and anti-inflammatories can also help. This is Dr. Brandt Gibson, and this was day number 4 of your podiatry tips. Tomorrow, we will change from heel pain, and we'll start talking about toenails and nails. And so we'll see you again tomorrow.